Hello, welcome to another conversation here. My name is Kevin Tocci, and today we have a special guest. At least for this segment, we have a special guest, a gentleman who is running for Congress, the 8th Massachusetts Congressional District. Right now, the incumbent is Stephen Lynch. The gentleman who is joining me, his website, if you go to it, Robbie for Congress, I think it's robbieforcongress.com. He'll tell me more in a moment. Dr. Robbie Goldstein joining us. Doctor, welcome to the program. Thank you for joining us.
Thank you for having me. And I'll say right now, it's actually robbieforchange.com. That's the website.
Okay, because I'm looking at it and it says Robbie for Congress, but I'm looking at the upper left hand side. I apologize.
Totally fine.
If you will, tell us a little bit about yourself.
So I am a physician. I'm a doctor at Mass General Hospital. I'm an infectious disease doctor by training. What I do is actually primary care. And I care for those that are left out of the system, the people that are most vulnerable. I care for people living with HIV, folks in the LGBTQ community, people affected by substance use. And about 5 years ago, I established the transgender health program at Mass General Hospital. And now I direct that program and provide care in the program as well. So I am coming to this race from a healthcare perspective. I'm coming to it after having hundreds of conversations with those that are most vulnerable, those that are most left out of our system, hearing their challenges and trying to figure out how we can best move forward together.
Now, is this your first time running for political office?
It is. I've spent the rest of my career in medicine, in the hospital, taking care of patients, also trying to create some systems change within the hospital and to do what I can to make the world a bit better from inside medicine. This is my first time jumping into government and politics.
So I would ask you, what was the main thing? There must have been some item that really energized you. Said, that's it. I need to get signatures and I need to run for Congress. What was it?
There wasn't one thing. I have to say it was a lot of different things that added up. I guess I'll say first, I actually don't think that medicine and government are all that different. And so it wasn't a huge change for me. I actually think that at their core, both medicine and government are about helping people. They're about making sure everyone can live a healthy life. And so I'm going to try to do that in Washington. It's the same thing I was trying to do here in Massachusetts in the hospital. But I think the reason that I decided to throw my hat in the ring to get signatures, get on the ballot, and move forward with this campaign is because of all of those conversations I had with patients, because of what I heard from them day after day, how hard it was for people to access the healthcare they needed, but also how hard it was for them to leave the healthcare institution and still live a healthy life. That includes making sure they had a house to go home to, food security, transportation, a job that pays a living wage, all of those pieces that really are required to make sure everyone lives a healthy life. And after hearing from so many patients how hard it was, I recognized we got to do something, right? We've got to create change. We've got to bring in a new perspective to help drive the right policies forward.
How do you feel that our government, the federal government, has handled the COVID-19 pandemic?
I think there's been a lot of missteps, certainly out of the federal government. I think if you go back all the way to December and January, when people in medicine, people in infectious diseases were sounding the alarms and saying, we've got to do something, our federal government was hampered. They were really in many ways not able to do what we needed them to do because of a lack of investment in our public health infrastructure over the past 10 years. That has been because of cuts to funding for the CDC and the NIH and the National Security Council and the World Health Organization, organizations that are really there to protect us and to get us ready and prepared for whatever may be coming. We didn't have that investment. It wasn't in place. And so, March hit us and it hit really, really hard. It took a long time for our federal government to activate in the way that it had to get PPE out to the right folks, to make sure that we had enough people to work in hospitals all across this country, to make sure we had the tests that we needed, that we could move forward with treatment, all of those things, right? We weren't ready because of where our federal government was. I look now at what's going on and I say, we've done some really great things. We have tried to get treatment out to people as quickly as possible. We have tried to get PPE out there, but we've got to do more. And we've got to do it with data and evidence driving all of our policies. And that's where I see a lot of failure right now in Washington.
How about members of Congress, or even someone who's representing the 8th Massachusetts Congressional District? What do you think are how they have acted in order to not only help folks who are in need financially, that we did see a stimulus, there's talk of a second stimulus, but at least making sure that if there's a second wave, that we're not reactive, but we're proactive.
Exactly. I think there are some examples of people in Washington, congressional representatives from the state of Massachusetts, who have done a really great job and making sure we're ready and prepared for the next wave if it happens, or the next pandemic after this. I don't think that the current representative of the 8th district is one of those people. I think he's been far too reactive and not proactive in the response that we need. One of the functions of our federal government, of the Congress, is oversight. That oversight needs to be put in place long before we see the problem. And instead, what we saw with COVID was oversight was happening 2 to 3 to 4 weeks too late. We were all of a sudden recognizing we haven't been investing in the right place. We haven't been making sure the tests get to the right communities. We haven't made sure that treatment is going out in an equitable manner. And the oversight was coming far, far too late. We've got to make sure that we have the right people in Washington who can apply that pressure and be proactive in what we're doing rather than reactive.
Interesting. We're talking here about COVID-19, but up until earlier this year, I think the one thing that was on a lot of people's minds was the opioid epidemic, and it seems that has kind of been lost in the shuffle. If you're a member of Congress, what are some of the changes, some of the things that you feel need to be done to continue to tackle efforts in reducing this epidemic and getting folks help, whether it's getting funding to your district or to your state when it comes to having enough beds and treatment and education in the schools?
Mm-hmm. Yeah, you hit a lot of great things there, right? Making sure we have enough treatment facilities so that people can access the care they need, making sure we invest in the education that's needed. Yes, at the schools, right, in public education, but also education for community organizations, education for healthcare institutions all across the state, to make sure that we're putting into place evidence-based harm reduction strategies that will actually help us get through this epidemic. One of the other things that I talk about a lot is it's not just the opiate epidemic. Certainly opioids are driving a lot of the mortality, a lot of the deaths that we're seeing, but a lot of addiction. And this is true for the patients that I see. It's addiction to other substances, amphetamines, cocaine, alcohol. There's a lot of other stuff that's going on out there. And we've got to make sure that we have evidence-based strategies to address all of those other substance use disorders. What I would love to see is for us to build on some of the experience that's happened here in Massachusetts. We've had some actually great successes here in Massachusetts, driving down the rates of opioid overdoses here, mostly by using harm reduction strategies. I also think we've got to look to some other places that have done well, some of them not here in the United States, but places like Vancouver have done a really great job at putting in harm reduction strategies and driving down overdose deaths. We got to look around the world, figure out who's doing this well. Where are there great experiences that have actually resulted in improvements, and then make sure we implement that in a widespread scale all across the country.
Okay, we're speaking with you, just tuning in, Dr. Robbie Goldstein. He is running for Congress for the 8th Massachusetts Congressional District. He is a Democrat, and we're talking about his being a part of this particular race, and somebody who's hoping that you'll vote for him come the primary in September. We've talked a lot about health issues. If we look what's going on in our country right now, what are your thoughts in regards to the fight to end systemic racism? What are your thoughts on that?
Well, I think the first thing that we have to do is we need to acknowledge that there is systemic racism, right? We have to really say that out loud. There is institutional racism in so much of what exists here in the 8th District of Massachusetts, all across the Commonwealth, and all across the country. That's the first piece, right? The next piece is we've got to begin this process of listening to those that are impacted by the racism and the injustice, right? We cannot have white people like me saying, I know the answer, and so I'm going to drive all of the change, right? The change has to come from those people that are most impacted by the racism. Over the past couple of weeks, I've been doing everything I possibly can to listen, to make sure that I'm listening to the voices of those people that are most impacted, and then allowing those people to really move us in the right direction. And I think we've seen some of that change happen. Some of that's happening at the federal level with the Justice and Policing Act, with the Andrew Curse Act, which Congresswoman Presley and Senator Warren are putting forward. Some of that's happening at the state and local level as we see justice coming back into the criminal legal system, as we see changes being made to police departments here in Massachusetts. But I want to make sure that we continue to do that process by centering the voices of Black and Brown communities and Black and Brown leaders in this country.
So I would have to ask you, you would talk a little bit about the justice system, law enforcement. How much reform do you think that there will need to be on the federal level? Would it be a matter of reducing funding, because that's what's being called? Even some states, folks are calling for the abolishment of police departments and policing units. Give me your thoughts in that area.
Well, I think we have to figure out, how do we best fund safety and security on the streets of our cities and towns, right? And for some people, they may say that is funding through the police department. I fundamentally disagree with that. I think that safety and security comes from funding our public education system. I think it comes from funding community organizations. I think it comes from making sure that we are putting the money into programs that actually do decrease violence on the streets, right? And we're going to have to make some decisions. We are facing very hard economic times and a recession driven by this pandemic that we're in. We've got to make smart decisions about what is going to be the most impactful investment to decrease violence and decrease the brutality that we see on the streets. So, I am in agreement with this idea that we've got to shift around our funding a little bit to make sure that it reflects where we're going to get the biggest bang for our buck in some ways, right? Where we're going to really maximize the safety and the security of our streets.
I think one of the issues on your website, robbieforchange.com, is prevent gun violence. Where do you stand when it comes to gun laws? What are your feelings?
So I stand with 90% of the rest of this country that believes in common sense gun violence prevention measures, right? Those are things like universal background checks. It's like closing the boyfriend loophole. It's like making sure that somebody can say, I'm depressed, I'm suicidal, I'm feeling unwell, and someone can take a gun away from that person so that they don't cause harm to themselves or to others. There are a lot of common sense interventions that we can put into place, and I'm fully in support of all of those. I'm also a huge proponent of saying everything that we need to do in the gun space, in the gun violence space, is all about gun violence prevention, right? We're not talking about taking away somebody's gun. We're not talking about whether or not someone has the right to own a gun or not. What I'm talking about is, how do I make sure less people are killed or hurt by guns? How do I make sure that somebody who is acutely suicidal does not have access to a gun where they could cause serious harm? How do I make sure that a kid who's at home and who stumbles upon a parent's firearm doesn't use that firearm in a way that could hurt that child or somebody else that's in the house? We're talking about violence prevention. That is something that the vast majority of this country agrees with. What we've got to do is make sure that that's the conversation we're having in Washington, so that we can drive forward with the policies that are needed to make our streets safer, our homes safer, everyone in this country safer.
I'm going to say this to you, Doctor, and that is the one thing that I'm pretty sure that they don't have, if you went down to your local pharmacy, is a container of common sense that you can take. You either have it or you don't. Do you feel that there's proper legislation on the books right now to help us move forward and control folks who have guns, or do you feel that further legislation needs to be written and enacted into a law?
I think there's some great examples of legislation here in Massachusetts. In Massachusetts, we have the lowest rates of gun violence across this country because of the legislation we have, but it's not working here. We actually still have a large number of gunshots every single day on the streets of Boston and the streets of Brockton. They're predominantly in the streets in communities of color where Black and Brown people are living. They're predominantly gunshots that are happening from guns purchased out of our state, not from Massachusetts, but brought into Massachusetts from other states. So we need some federal legislation that is going to make sure that people can't purchase a gun from another state and bring it into our state, so that we can make sure that there's federal investment in some of the community programs, like the ones here in Massachusetts, that really hold up survivors of gun violence, make sure they have what they need, make sure that the education that is needed to talk to kids about guns is there. So there's a lot that we still need to do, but we can model a little bit after successful legislation here in Massachusetts.
You know, one of the things that a lot of folks do worry about is what's going to become of our climate. We see so many different signs all around us, and I believe that you're someone who is a proponent for action. What actions would you like see to be taken for the betterment, for the future of our children and their children?
So I think about the climate, and I think about our climate crisis with this one framework, which is that we've got to do two things here. We have got to manage the unavoidable, and we've got to avoid the unmanageable. To unpack that a little bit, we all need to recognize that no matter what we do, we will see an increase in global temperatures. We will see an increase in the sea level about 1 to 2 meters over the next 40 to 50 years, no matter what we do as a nation, no matter what we do as the world. And so we've got to be ready. We've got to adapt. We've got to make sure that our streets are ready to withstand the higher temperatures, that our bridges are ready to withstand the higher tides, that the homes all along the shore are ready to deal with whatever may come. That adaptation is so important to our overall climate package. And then we've got to do the other work, which is avoiding the unmanageable, right? Making sure that we are investing in renewable energy, in wind and solar, making sure that we're investing in energy efficiency in our buildings, in particular our homes and our schools, our office buildings, making sure that we are doing everything we can to slow those changes that we're seeing and eventually get to a plateau, or even, if we're incredibly lucky and we do a really great job, to start to bring us back down towards where we have been in the past.
So we were talking about climate change, climate action. I know one of the other things that you are for is for affordable transportation. Are we talking green technology? Is that what you're more geared towards, making sure that we're environmentally friendly, but yet it's something that the modern everyday person can be able to afford?
Absolutely. I mean, I think when I'm thinking about transportation, I think about this at many different levels. You've got the very, very local transportation of what happens on the streets of small cities and towns all across Massachusetts, right? So how do we make sure our sidewalks are safe and wide enough? How do we make sure there are bike lanes so that people can get to and from places on a bike and they don't have to take a car? But we also got to think about it in the broader sense. How do we make sure that the roads that we're building are connecting the right parts of our Commonwealth? How do we make sure that they are leaving enough space for public transportation like buses? How do we build up our MBTA system so that people can use public transportation to get to and from where they need to go? Right, there's a lot that needs to go into it. But I think about it in a way that we've got to think, how do we build up communities? How do we do that in a way that is good for our environment and brings in all of those environmental policies I was talking about? And how do we do one also that begins to think about some of the structural racism that we talked about before, right? And why certain towns, certain areas of this Commonwealth are completely disconnected from other pieces. And a lot of that has to go back to that historical and institutional racism that exists.
Again, if you're just tuning in, we are speaking with Dr. Robbie Goldstein. He is a candidate for office running for Congress, the 8th Massachusetts Congressional District, and we're talking to him about his campaign for office. Hopefully you'll vote for him during the September primary. I'm sure it's been difficult because of COVID-19 for you to get out and engage the voter. What are some of the things that your campaign has had to do to be creative to speak with folks? And what are they telling you their concerns are if you, in fact, you do go to Washington?
You're right, it's been challenging. We've transitioned very early in the setting of COVID to a completely virtual campaign, or a mostly virtual campaign. And we've done a lot of Zoom chats and a lot of phone calls and text messages to try to get word out about the campaign. do have to say, over the past couple of weeks, I have done what I can to be with folks in the community as they've had vigils and marches and protests all across the district. I was in Whitman just last weekend. I was in Hull last weekend. I've been down in Brockton, here in Boston, all over the place, trying to be with folks. People are talking to me about the same issues that we were talking about in November in some ways. We talked about healthcare, we talked about racial justice, we talked about our criminal legal system and the reform that's necessary. And now all is taking on even more importance, and is all being put together in the context of what's going on in our nation. We were talking about healthcare in November, and certainly we're talking about healthcare now in the setting of COVID. It just has a much different importance to it, a different weight that has come in. We were talking about racial justice in November. We're certainly talking about racial justice now. I think there's now a lot of examples of why the policies I was talking about in November are so important, and how they may have played out differently over the past couple of weeks.
Doctor, we got a few minutes left in our conversation. We've kind of remained domestic with our conversation, but as a member of Congress, it's more than just the United States. We are part of a global partnership. Give me your assessment on our foreign policy as a country, and some of your concerns and some of the things that you'd like to lead the conversation on when it comes to us being part of, the global market.
I think for many aspects of our foreign policy over the past 3.5 years, I would use the word failure. I would use the word failure to describe what has happened. I think that we have transitioned from being the strongest and in many ways the best diplomatic corps that the world has seen to a country that uses force excessively and has backed away from its diplomatic ties. Instead of making friends and building relationships all across the world, we have instead pulled back from all of our friendships. What I would like to see is us to invest in our diplomatic corps. I'd like to see us build our State Department back to the levels it was when Secretary Clinton and Secretary Kerry ran the State Department. I'd like to see us remove some of that funding that we are throwing into these forever wars that are existing in the Middle East and these continued armed crises that we see in places like Asia and places like Central America, and instead invest that money in diplomacy and in peacekeeping and in the hard work, right, of building allies. And I think we've seen that play out in so many places, but in particular, we actually see that play out along our southern border. And we've got to start thinking about our immigration system and our immigration crisis as a failure of our foreign policy so that we can invest in the right space.
So I'll ask you one more question in regards to foreign policy or our place globally, and that is the three concerns. I think anybody who is cognizant is China is a growing superpower. Where we are when it comes to the Middle East and Iran and North Korea. If you were to pick one of those, what concerns you the most, and what are you hoping that we can do when it comes to diplomacy and our standing when it comes to other countries around the world?
It's hard to pick which one of those has deteriorated the most over the past 3.5 years. I would think in many ways that China is going to play an enormous role in our overall foreign policy and the way that we as a country get out of this recession. And we've got to make sure that we repair our relationship with China. I'm not saying that Iran and North Korea are not important. I think they're incredibly important. But what I have seen happen over the past 3.5 years has been really antagonism with China, which is going to leave us incredibly vulnerable as we are trying to find a market for all of our goods and all of our services as we rebuild our economy. And as the rest of the world is trying to rebuild, and there's in some ways a vacuum, right? And who is going to come in and fill that space? China has been strengthening themselves year after year with President Trump in office. And that strengthened position puts them in a very good place to fill that space, right? I don't think that that's strategically an advantage for the United States, and we've got to make sure that we rebuild our relationship. We work in partnership with China. We work with them on their human rights violations. We work with them to make sure that that they are part of the conversation, and not that we are just sort of at odds with them at all times. I think it is a huge strategic blunder from the United States over the past 3.5 years.
Before we wrap up, is there anything we haven't touched upon in regards to you and your campaign, but you want to take a moment to discuss as an issue?
Yeah, I mean, I think the one thing I'll say about me and about this campaign is that this campaign is about bringing a fresh perspective to Washington. It is about recognizing that the current congressperson has been in office for over 18 years, and the district has changed in that time, but the congressperson hasn't. It's time that the district has a representative that shares its values and leads with those values every single day in Washington. So that's why I got into this race. That's why I'm still in this race. And that's why I fully expect to win in September in the primary.
Doctor, if folks want to find out more about you and your campaign, how can they do that?
Best way to do it is to go to our website, which is robbieforchange.com. On there, people can learn about the campaign, can send me an email, get in touch with me. One of the things I always say is that this is a conversation. And so I am happy to talk to anyone about anything at any time.
Doctor, I want to thank you very much for being our guest.
Thank you for having me on. This was great.
You got it. And thank you for tuning into this particular segment, especially when it comes to a candidate. It's so tough with the environment, with COVID-19, with the pandemic, for them to be able to get out and engage one-on-one and attend functions. So it was great that to have Dr. Robbie Goldstein's campaign reach out and ask to do this segment. And we hope that you will check his campaign out and many others who are running for office. Thank you.